Welcome to the office. Welcome to the office.
Thank
How
you.
you doing, Jesus?
I'm feeling great today.
So I want to introduce Jesus. He's been with me since 2022. And he came at an interesting time. And when he came, he comes from
I come all the way from TJ's, like 3 hours away from here,
Tijuana.
from Tijuana. Yeah.
Tijuana. And how did you find me?
Actually, I was looking at YouTube, trying
Okay.
to find from all the cases that you guys have, trying to find a case that was related to what I was feeling at that time.
Okay.
So
Did you find something that you related to?
from different cases, like stuff that I was feeling. So that's why I took the decision to come here because I thought that I could find the answer to my
What was
problem
going
here.
on?
I had like so much issues like going on in my low back, like I couldn't even walk like for probably like 30 minutes. I was feeling this um bugging like pain in my low back. So that's why I had a trip coming down. I had to go to Europe, but I
Yeah.
didn't want to go just with that pain.
Right. And then we worked on you for quite a bit.
Yeah.
And I give him props. He would drive from TJ, on a regular basis. We were seeing you several times back then.
Yeah.
And now you come for tune-ups, right?
Yeah, like probably like in the regular basis, like once every 2 weeks, and then once every three, and now once every month.
Or every
Please.
couple of months, even
Yeah.
sometimes it depends, right?
Yeah.
And you were going through a lot back then. And one of the things with Jesus, he used to fight me. He would fight, and he wasn't getting it because I kept talking about letting go and receiving, and he was in so much defense. And I mean, you had reason to with life situations going on, but it took us a couple years, actually, year and a half, almost 2 years, right?
Yeah.
And just for you to start to receive the adjustment, right? Is there anything else you want to share from back then?
Well, basically, I mean, I'm like all happy right now because I remember that when I came here the first time, I came here with the pain, and like since the first like three adjustments that I had, I felt my body like something went out, something went out, and I started walking more, having more minutes walking, and I had this like positive vibe of like my body receiving something that I needed.
Okay.
So right after that, like comparing from the first time I came here to now, I feel my body like totally different, like
So what's different? Like you work, you have your
um,
business, you have a family, you have a newborn baby.
yeah, actually, like new baby came. I have a business going on over in TJ. I started working out now. I'm like 90% more active than comparing to
And I'm
before.
sorry, there's a generator started somehow outside, of course, right? Hopefully we don't pick it up on the way. I'm sorry, I didn't mean to interrupt you.
Don't worry.
So life is
Yeah.
better now,
Yeah,
right? In
life
terms
is
of
totally better.
quality and your activity levels.
Yeah, yeah, yeah.
And
That's
playing
totally
with
different.
playing with your son, I think, is kind of cool.
Yeah.
Without pain, right?
Yeah.
Cool. And we did some new X-rays. And is it okay if I share?
Yeah, yeah, that's fine. Totally
So what I want to do is I actually want to go over his X-rays before and after from 2022 till today, which we're in February 25. Okay. So why don't we come over here, please? Cool. So what I actually wanted to show was when we look at your foundation, this is May 24, 2022. This is today, February 14th. Happy Valentine's Day,
Yeah.
everybody. It's February 14th, 2025. And if we look at the foundation, okay, what we see are a couple of interesting things. And the first thing we see is the leg length discrepancy from 7 millimeters is now 2 millimeters. We can see the rotation of the pelvis from PI10 IN7 is PI7 IN3. So the twisting is less, the hip is more balanced. The rotation of the sacrum is still there, but look, we were working down low on the tailbone.
Yeah.
And from that, we got it up, dropped from 5 to 1. And they say it's not possible. Do you mind saying your age?
Yeah, it's
Oh.
I'm 33, about to be 34.
Okay, and so what's interesting, the reason I asked you that, because the books say that the sacrum fuses by 32 to 34, and there's nothing you can actually do for it, and inferiority listings are not no longer taught. And it's important to understand the inferiority listing and malformations, and they are correctable. Not all of them, but a lot of them are.
Yeah.
Okay, so I just wanted to share that part. Now, going back and looking where we're at, we'll see what we find today. And we're basically going through whatever we find per visit now, right?
Yeah.
And the idea is we did all this work. We did a lot of work.
Yeah.
And it's nice now that he maintains. And you know also, there are times life happens and we lose our activity levels and we start to emotionally eat, or the comfort foods, and the inflammation kicks in, and
Yeah.
now you know how to catch yourself, right?
Yeah.
Right?
Yeah, that's totally one important thing that I learned here with Dr. Rahim was just to listen to my body. And one of the main phrases that Dr. Rahim told me or taught me since the first time I came, it was do not follow the pain, or do not follow to pain. You know, so
Don't chase the pain.
yeah, don't chase the pain.
Don't chase the pain.
That's the one. So I remember that when I used to feel that little pain, like whatever, like in whichever part of my body, I used to just be like you know, like chasing the pain, like where's the pain? Where's the pain? I don't want to do anything. So I just started letting go, you know, letting go. Like I feel the pain, okay, he's gonna be there, but I'm gonna be just going with myself and do some stuff, like having stuff to do, and just forget about it, you know.
And then what happens?
It's been going away, like little by little, but it has been going away because you learn, like you have this picture right here from the spine, that you learn that all the stuff that you have going on through in your head, in your mind, like life to life problems and all that stuff, they catch you and they can get into your spine, and then you start getting all these issues going on. And then once you learn every vertebra has to do something with your, like how do you say, your every part of your body,
function.
like yeah, your functions, you reflect those mental issues in your body. Now it's like that's my part, you know, like work on those stuff to just let go and be more balanced in every aspect.
That's awesome, dude. And you shared something earlier when you came, right? Because there are times, a lot of times, I make suggestions to people about reading certain books, or if they don't want to read, then they can get the audio book. And I did mention a book to you.
Yeah.
So tell us about
Yeah,
it.
that I remember that time when I came, I was just not letting go, actually, not letting go. And actually, I had my quick adjustment, and right after that, I went to buy this book. It's called Let Go. I don't remember the author right now, but it's the book. The book's name is Let Go. So I started reading that. Everything became more clear to me. It's easier now. And then from now on, I'm on my fourth book, not from the same author, but different books that like help me mentally just let go everything that's happening on my day by day.
But the thing you failed to mention just now is you never used to read.
Yeah,
That's kind of important.
I'm really a bad reader. Like I don't have that habit, but just from that book to now, like I'm on my fourth book, so I created that habit. It's a good habit. So basically, creating good habits that help you like become better person, it's gonna help you feel better in everything, in your like your muscles, everything. Sometimes you wake up and you don't want to go to train or take your 10,000 step walk or everything, but there's some things that you have to do every day, you know. Even though you don't want to feel, or you don't feel like doing it, that's when you have to
You got to move,
yeah,
right?
you gotta move.
You got to
Yeah.
keep moving. If you're not moving, you're degenerating, guys. All right.
And another thing that I want to add is that like everyone, like every person, it's a different world, and there's a different process for every person. Like my process, probably it's longer than for other persons, but you just gotta trust the process and trust whatever you're doing.
That's it, brother. I appreciate it. You ready to get started?
Yeah.
You ready to receive?
Yeah.
Let's do it, baby. Okay, Jesus, let's see what's going on today.
Yeah.
Anything specifically bothering you
Oh,
today?
I think like right now, like the main stuff, it's like concentrating probably like in my mid back
Okay.
and probably a little bit of the low back, heading towards my right side.
C6, base of the neck, 8 points. C1, right side, 5 points. T6, T7, left side, 5 points. Sacrum, left side, 5 points. T7, C6, C1. Those are the 4 spots we got going on today. We're going to check the hips first.
Yeah.
Feet together. Feet together. Open and close your knees with your feet touching. Checking general motion of the sacroiliac joints, left side only. When he does the left, little movement on the right. Do the right side only. Bigger. Left side. So they're both kind of stuck, but the right one is a little more stuck. So I'm actually going to be working on that rotated sacrum today, okay?
Right.
Scoot back for me, please. Scoot back. Head down. Dude, that thing was annoying, yo.
What was it, inside or outside?
What? Outside.
Yeah.
So weird. 7-1. Static palpation, running our fingers down the spine. You can see all this inflammation and just running the fingers. That's all pulling edema. 1, 2, 3, 4, 5, 6, 7, 8 or 9. 8 or 7.
I think.
Starting here.
Yeah.
Right there. 9. 9. Right sacrum. Come back slowly. Now, there's also no curve in his spine when you look at his lateral, and that's coming from the AS pelvis, which is also on the right side. Now, we're going to do a quick leg check to determine if we're going to do the sacrum or the pelvis. When we have a rotated sacrum on the side of a rotated pelvis, and we're trying to differentiate which one we want to adjust, we're going to do what's called the Gonstead leg check, okay? Sit back for me, please. Scoot back. Let's check the neck. Head down, please. Good. Very nice. All right. C1. So we're doing lateral flexion. In lateral flexion of the cervical spine, many ways you can do it. You can be on the articular pillars here, sure. You can be on the spinous. If we laterally flex to the right, there's contralateral rotation of the spinous process, so the spinous should go to the opposite. They say the spinous will go more to the open side of the wedge. So when we do it, he's getting more movement to the left side, which is the side of his wedge. And if we look on his x-ray to confirm it, the wedge is on the left side for C6. Okay. You ready?
Yeah.
Booyah. En su nombre, Jesús. His name is Jesus. Relax the shoulder. You gotta come underneath. Under. That's the home run, baby.
Like butter.
Like butter, baby. You've met a lot of people here at the office, yeah?
Yeah.
C1. Drop that right.
Oh.
That's the home run, baby. Walk it out. Orale. Pretty cool. All right, let's do the Gonstead leg check. So for the leg check, we're looking here, right? We want to do the right side. Now, we're looking, we see the right side is shorter there. When we bend the knees, if the right heel stays shorter, it's sacrum. If it goes longer, it's pelvis. So we can see this is shorter. We're going to flex the knees 90 degrees, and we're going to see if this side stays shorter, it's sacrum. If it goes longer, it's pelvis. Still shorter, so that's going to be sacrum. Come on up, bro. Now, walk it off once, and then we're going to start the tailbone on the side. Cool. Let's go left side down. Happy Friday, everybody. Juma Mubarak. Bottom leg straight. Top leg is bent. Let's roll you slowly as a unit. I got you the whole way. We're doing the rotated sacrum. The cobra's back. He's a cobra. You okay there? A little more. There you go. Come up slowly. And we're going to go face down over here for more. Now, ideally for the rotated sacrum, they say to be on the opposite side, which is where we're at. That's the ideal textbook. And you're bringing it into you this way. You good, bro? All right, so we want to bring it in this way. That's the home run, baby. Sweet. Ocho or nueve? 8 or 9?
They feel like the same, but I think I'm feeling more 9.
Gotcha. Suave. He actually received today. Good boy. Good boy.
So sacrum was holding, right, for a long time.
Yeah, man. Long time. Walk it out. Check it out. Bueno.
Yeah.
Siéntate aquí.
That was spicy.
Yeah, it was. I mean, you travel a long way, dude. There are a few Ganse guys out there, and if it's ever an issue for you to come out here, I can make the referral. Yeah. And I've made a few referrals out there, and, you know, you got to find the person that's right for you.
Yeah.
And the person can be better, and you don't click with them. Person can be not as experienced, but you click with them, and you know you don't mind spending the extra doing the extra time in visits.
Yeah.
Go on your back, please. You're all clear there. Raise your right leg. Raise your left leg. Relax the foot. Awesome. Sit up and turn. So we didn't share your first story, but you decided you wanted to share now, right?
Yeah, like the first, like since the first visits.
Yeah.
Yeah.
But why did you decide you wanted to share now?
I mean,
Why did you want to share now? And it's been a few years, right?
Yeah, I mean, because I since the first before I came here, I started reading like the reviews from Dr. Rahim and stuff. And you know, there's a lot of people that they tell you like, oh, I came here, I paid a lot of money, and I didn't solve my problem and stuff like that. Like I said before, every person is a different world. The process is different for everyone. For every single person, it's different. I came here and I'm here like probably like 2 years and a half. Not coming like every single week, but probably like once a month, once every like 2 months or stuff like that, depending on how my body responds. So one of the biggest things I have learned is that I have to listen to my body when it's time to come here and receive, because you work hard, you do a lot of stuff, you get stressed, and you get to a lot of stuff like in your day by day life, and you have to give your body what it tells you or what it requires for you to be in a balance. And for me, this I have found balance here for my body and for my life.
En español.
You want me to tell you in Spanish?
Poco.
Un poquito.
Poquito.
Decidí venir aquí con Dr. Rahim porque aquí fue el único lugar en el que pude encontrar una respuesta al problema que estaba teniendo. y después de hacer visitas por 2 años y medio en un periodo de una vez cada mes o algo por el estilo, he encontrado esa recuperación en mí que me ha permitido volver a hacer todo lo que solía hacer en mi vida y ahora que tuve a mi bebé, poder entrenar, poder trabajar y concentrarme y aprender que tengo que recibir y dejar ir todo lo que no es bueno para mi cuerpo.
Órale, vato. Now let's continue and finish up the shoulders, the ears. Sit back for me, please. You made some good sounds today.
Yeah.
And now let's buff it out. Good stuff, dude. Five, four, three. Squeeze. Elbow. Squeeze. Squeeze. You're all set. I appreciate you, bro.
Yeah,
Okay.
thank you.
And I appreciate you driving, for your adjustments. It's not easy. Okay.
No, it's not
It really isn't, guys. And the fact that he does it is it's cool. But more importantly is I even appreciate you shared the story. And that's the big thing because look, everybody is different.
Yeah.
People got to do the work. Number one, we're helping, we're facilitating, we're helping, we're guiding. But ultimately, yes, at the end of the day, it's on the individual, right? And some people respond really, really quickly. Yes,
Yeah.
sure. Some people take time, but it's lifestyle process. And the biggest thing I love in his case is that we got the sacrum up, we got the hip up, dude.
Yeah, yeah.
So that is the most important thing. Now all the other stuff we can work with. And if we weren't able to get the hip up, what was the option? We were talking about heel lift.
Yeah.
Right? And we don't need to use
Yeah.
one now anymore. Awesome. Brother,
Yeah.
take care.
You too.
All right.
Thank you.
Yep.